This is Chapter 15 of the Brain Resource Creation Workshop, which focuses on neurodegenerative diseases. We would like to extend a warm welcome to everyone watching this video right now, and we thank you for your interest in this workshop. The presentation is brought to you by Simply Neuroscience. It has been created by Phoebe and edited by Prakrati, Skylar, Jed, Ria, Krish, and Annika.
To begin, let's define some terms that have to do with neurodegeneration. Neurodegeneration is a progressive loss of nerve structure and function, which in turn leads to the loss of cognitive abilities such as memory and decision-making. Neurons play a big role in neurodegeneration. Neurons are the building blocks of the nervous system and normally do not divide mitotically or replace themselves when damaged or destroyed. Now, neurodegeneration is a key aspect of a large number of diseases that come under the umbrella of neurodegenerative diseases. Of these different disorders, the most notable are Alzheimer's disease, Parkinson's disease, multiple sclerosis, Huntington's disease, and Amyotrophic Lateral Sclerosis.
First neurodegenerative disease we will talk about is Alzheimer's disease. Alzheimer's disease is a progressive neurodegenerative disease that mostly affects patients in their later stages of life. It is also a common form of dementia. Typical symptoms of Alzheimer's disease include loss of cognitive function such as emotion, learning, and memory processing skills.
In terms of risk factors, approximately 70% of patients living with Alzheimer's disease have inherited the condition. Other risk factors include a history of head injuries, depression, and hypertension. The pathology of Alzheimer's disease includes an enzymatic impression. The deposition of amyloid beta protein plaques and an accumulation of tau proteins within neurons characterize the pathogenesis of Alzheimer's disease.
These amyloid beta protein plaques are problematic as they disrupt synaptic transmission and neuron-to-neuron communication, which ultimately results in neuronal death. Tau proteins that accumulate within neurons form tangles and work to inhibit the transportation of nutrients and other vital cellular components within the cells. This too results in cell death in the form of atrophy.
Another neurodegenerative disease is Parkinson's disease. Unlike Alzheimer's disease, Parkinson's disease is a progressive neurodegenerative movement disorder. Parkinson's disease results in neural death in substantia nigra, which is physiologically important for reward and movement pathways. Other affected neurons include those that help synthesize dopamine, a messenger that controls movement and coordination.
In a patient with Parkinson's disease, the net amount of dopamine produced in the brain is decreased. Dopamine is an important neurotransmitter for movement control, so this decrease leads to the patient being unable to move normally. Non-motor symptoms include depression, sleep disorders, respiratory issues, and more.
The third neurodegenerative disease we will discuss is multiple sclerosis, or MS. MS is a chronic neuroinflammatory disorder that affects the central nervous system by demyelinating the brain and spinal cord. Multiple sclerosis is a disorder that primarily affects individuals between the ages 20 and 40. It is triggered by a virus that occurs in individuals who are genetically susceptible to the infection.
The numerous symptoms for multiple sclerosis, which include ataxia, which is impaired balance or coordination, spasticity, which is abnormal muscle tightness due to prolonged muscle contraction, and speech disturbance.
The fourth disease we will cover is Huntington's disease, which too is a rapidly progressive neurodegenerative disease that ultimately results in dementia. Symptoms of Huntington's disease often arise as mood and character alterations, as well as disturbances in memory and attention. The progression of Huntington's disease also usually results in movement disorders consisting of involuntary motions.
Huntington's disease is not usually detected until a patient reaches adulthood. The disease, which is genetic, is caused by an autosomal mutation, which means that the child of an affected parent has at least a 50% chance of inheriting the disease.
As the disease progresses, individuals may have a hard time concentrating, making decisions, or recognizing previously familiar objects. And over time, judgment, memory, and cognitive functions will deteriorate.
The last neurodegenerative disease we will cover today is amyotrophic lateral sclerosis, or ALS. ALS is a progressive disease that entails weakness, twitching, and dysphagia, which is difficulty swallowing. Two categories of ALS include sporadic, which makes up to 90% of diagnoses, and familial ALS, which makes up to 10% of diagnoses. Overall, ALS is caused by the death of upper and lower motor neurons.
Familial ALS, or FALS, is commonly caused by the overexpression of C9orf72 gene, or the misfolding of superoxide dismutase, SOD1, protein. A healthy individual usually has C9orf72 expressed 2 to 23 times, whereas FALS patients express it thousands of times. When SOD1 misfolds, it forms aggregates in the brain and causes the death of motor neurons.
To practice what we have learned, let's complete a diagnosis activity. You'll be given a person and their symptoms. Your goal is to figure out which condition they have.
Our patient's name is James, and he is 30 years old. James has been experiencing some vision loss and has been complaining about the dizzy spells he has been having. In addition, he has been having some speech disturbances along with weakness in his overall body. Pause the video to think about what neurodegenerative disease James has. That's right, James has multiple sclerosis. How do we know this? James's symptoms include vision loss, dizzy spells, speech disturbances, and weakness, which are all indicative of MS.
Thank you so much for joining us today for Chapter 15. We hope you visit our website, simplyneuroscience.org, for more information, and please feel free to contact us if you have any questions.